Hey, everybody. Happy holiday to all of you. Hope you all had a wonderful Father's Day if you're joining us live. And if not, then catch this and ask us any questions you have. Join Blair on the Cannabis channel right inside of RPH Ally. Head over to rphally.com and check it out. Today, I want to tell you, Blair and I are really just catching up on what's been going on. There's been a lot of activity in the cannabis world, and Blair's trying to make sure that pharmacy stays as a major part of what is happening there, especially in the state of Georgia. So get ready for some updates from Blair in the overall and arching space of cannabis. We'll see you in a second. All right, Blair, let's jump right into it.
Thank you so much, Kevin. Yes, hello, everyone. Yeah, happy Father's Day. Hope everyone had some good time off. But yeah, there's quite a few changes coming up with, the hemp farm bill. They're going to be looking at some things. DEA has really moved on and essentially gotten rid of, or at least legitimizing the fact that they're going to stay with CBD and, Delta 9 THC, which is the psychoactive component and everything. They're going to let the states deal with that as well. But like the THC, O-acetate, HHC, all these other kind of derived, supposedly derived from cannabis, but they're actually synthetics.
Yep.
They're illegal now. So any kind of conversion. So if you're doing CBD conversion to Delta 8, which is technically legal, Delta 8 THC is technically legal because it is coming from hemp, but the conversion from CBD to Delta 8 is illegal. So they're hampering down on that. So essentially, if you're purifying the Delta 8 THC from hemp and you're extracting it without any chemical conversions or anything, Delta 8 THC is less than 1% of the entire component. So you're going to have to start purifying that, spending a lot of time. And that's going to increase the price. So there's going to be quite a bit of competition. People are probably going to be moving away from that. Several states have already illegalized, made Delta 8 illegal.
Wow.
So it'll kind of help the competition with Delta 9, the actual true marijuana stuff. It'll help with that component and the medicinal side.
How are manufacturers adjusting, Blair? Because it sounds like from the pharmacy perspective, us practicing clinically, like this application will really have to do with the product selection that we may have available to our patient and constituents. But how with these rules and regulations updates, and then if you can give us a little bit of history on what it looked like previous to these changes, what's going to happen to the manufacturing world after these things are put into place?
Yeah, you're going to see more of the concentration of what was, really on the product shelf prior to 2020. So if you're looking at, basically true CBD hemp products without any conversion, without any chemicals, this is what we've been striving for pretty much between 2014 to 2018. And then in 2018, they were saying, yes, this stuff is legal. And so a lot of people have been playing with really stretching the envelopes and breaking the law kind of along the way.
Wow. And so now that we've got these changes kind of happening in place, Blair, what is that going to do now from, you talked about the manufacturer side, that we're really going to have to get to a much more pure baseline utilization of cannabis as we think of it. But from the pharmacist clinician side, now will there be products that will be limited that potentially their patients are already using and leveraging? And how do we help those patients to move toward a different product set in the CBD cannabis space?
That's a really good question. If you're familiar with the manufacturers and the products that are available, the certificate of analysis will be readily available for you to review. And you need to really review that stuff to make sure it makes sense of what's on the certificate of analysis and how it compares to what's on the label. And you'd have to really look for those conversions. Say, if someone's looking for, pain relief or so, you're going to have to use a higher dose anyway with CBD products. You're looking 100 milligrams to 300 milligrams per day. for something like that, along with anxiety. If you're looking for, someone to help someone with their mood stability or anything, doses between 10 to 50 milligrams per day is
Hmm.
something that can help boost a mood and help with anxiety, but has that biphasic kind of abilities to it. So if you want some more doses or anything, you can it definitely hits 100 to 300 milligrams. So you're gonna have to look for those products. They're going to be within line on pricing
Uh-huh.
and with what it says on the label. Now, a lot of labs or so say 17025 is enough. ISO 17025
Uh-huh.
is the testing that a lab will go through for accreditation. And that's just basically a driver's license. Now, if
Okay.
you go a little bit higher, you have the FDA or CFR, I think Part 21 to 11, which is basically USP grade. So
Okay.
you're getting into more of quality assurance within the whole program. 17, ISO 17025, the driver's license, they basically are looking at the end product. So
Hmm.
if there's any problems or issues between the start and the finish, they're not going to figure out where that problem really is.
Got it. So when we're looking at like supplements, for example, Blair, like looking at supplements and things that are over the counter, there's usually a USP or some other seal of approval that's on the outside of those supplement bottles. What's the case with cannabis? And I think you're already educating me there. What are some things that are really quick identifier for both patients and pharmacists to say, here's something that shows that it's gone through a more consistent and or higher level of validation for the product that's inside of this bottle?
Correct. So if you don't find the USP like a seal or anything like that, they haven't gone through at least the lab process and the manufacturing process of figuring out where problems could arise. There's much more stringent quality assurance programs that go into these. So, say, a lot of these multi state operators within the cannabis industry that are authorized to do medical cannabis,
Hmm.
most of these guys aren't even in the level of USP.
Okay.
These just basically have a driver's license ready to go. And a
Hmm.
lot of these products are mislabeled. The certificate analysis, you can find a variance between what the lab has said what's in there and what is compared to what's on the label.
Wow.
So if your patients are running into issues and problems, it could be the fact that it's a mislabeled product. So you
Okay.
have to report these things to your local or state cannabis program and just keep a watch on this.
Where can folks go to do that? Like, with what is a local and state? Because I know the next subject we're jumping into is something near and dear to your heart in the state of Georgia and what you guys are trying to do there and changing
Yes.
the way that cannabis is utilized and the role of pharmacists and healthcare practitioners. But when it comes to your state and when you're working with things, who is the state? Like, it varies. I guess I already know that.
It'll
When
vary between state.
Okay, maybe there's our answer. So let's switch right over then to Georgia and what's going on there and what's exciting about how Georgia's doing it different and how you feel like the
Yes.
rest of our pharmacy world needs to pay attention and start thinking about getting these things enacted inside of their states.
Correct. So here in Georgia, it's very unique where the independent pharmacists are going to be able to get a license to dispense medical marijuana here in Georgia
Oh,
without any affiliation to any of the producers or manufacturers. It's very different compared to any of the other states that are running with pharmacists involved with dispensing medical cannabis. So this is a really cool experiment to help out the independent pharmacists, get a new streamline of revenue, and build out new relations with the local physicians in the area.
wow. Wow.
Mhm.
Break it down even deeper for me because when I'm hearing that right now, Blair, and just hearing that pharmacists will be involved in medical grade cannabis, thinking about
Correct.
my little area I'm in up in the Northwest, there are a number, if you want to find cannabis, medical grade or not, in the state of Washington, there's a lot of areas you can go to be able to pick up cannabis, right? So in Georgia, how is that different now that a pharmacist is involved? Is there a requirement for pharmacist oversight? Or is it just the opportunity for a pharmacist now to differentiate themselves inside the market by being able to enter into one of these business arrangements?
Yeah, exactly. It's almost a segue essentially to do different operations. We're already involved with controlled medications and dispensing and keeping the safety of the residents here in Georgia. So that's our responsibility. So it's kind of passing along that realm that we're already knowledge of, and it'd be great for us to keep expand upon that knowledge. I think it's something for us to. I mean, it was in the USP for so long. Why not put it right back in there? I mean, we're already here, involved with the patient outcomes and trying to reduce adverse effects.
No, that makes sense. So when we're looking at Georgia, our next steps, Blair, do you think inside of the states, really, you're hoping more pharmacists get involved by now becoming owners of medical cannabis dispensaries, and with that, they're going to showcase here's our skill set. Like this should already be part of,
Exactly.
because looking at a drug topics article just a little while ago, Blair, that I was telling you about before the show, one of the authors inside of there was really speaking towards some of the major concerns in the industry. One being, are pharmacists educated enough? Which, that's something that you're trying to champion with providing more education toward pharmacists so they can be more competent in this space to be able to help their patients. The other ones were laws and regulations. Like, are we setting our patients up for success by leveraging the profession that should be taking care of these patients with any drug that they're coming across, meaning pharmacy. And then the last piece, Blair, inside of there was really related to counseling concerns. So what is happening at the counter right now when someone is, I'm coming across a lot of opportunities inside of the independent pharmacy space, which is interesting. I'm sure, when I was a hospital pharmacy director, I came across the exact same issues inside of the hospital, that someone was coming in already using medical cannabis, to treat a variety of things. So when it comes to that counseling space, Blair, let's say that we have a new patient that comes in, and this happens all the time at a pharmacy. They're curious about a CBD product, right, that you're currently carrying.
Mm-hmm.
When it comes to good resources for you to become a more skilled counselor about the CBD products that you could be carrying and educating your patients, you're just mentioning, X number of milligrams for this potential utilization, another variety of milligram kind of strengths for this indication. Where would you ask them to go, or where do you think is a really solid basis for them to have a foundational knowledge around counseling their patients on just CBD for right now, let's say?
Yeah, that's a really good question. Some people that I've been following for quite some time is Dr. Bonnie Goldstein. She's out in, I think, San Diego, California or so. And then there's Dr. Sulak. He's up in Maine. So we have, very diagonal sides of the United States, but they're also performing and very knowledgeable within this industry using one's kind of more focused on the pain and the healing side, and the other one is she's kind of dealing with autistic children and having fantastic success by coming up with different blends and kind of outsourcing the manufacturing, I think, of her particular brands and such
Wow.
to one of the manufacturers out there. So they're doing really good.
And where do they have, like, I'm looking right now at one of the websites, where would I find the counseling information related to utilizing CBD and me being a more educated pharmacist? Or is there a specific site or thing that I should look at, Blair, when I'm trying to pull up either of those two clinicians?
Um, they have their own websites. I
Okay.
think the only one that I can think of right off the bat is healer.com. As in, he's a healer. So I think that's Dr. Sulak's website. And it's been a little bit since I kind of visited
Well,
either of
those
those
in the
places.
show notes. That'll be perfect. We can just put some of those resources in the show notes for folks to
Hmm.
go, hey, I'm looking for more education on in-depth counseling or consulting inside of the CBD space. Here's a spot for you to go and be able to get that kind of education. What
Will
things are
do.
on the horizon then, Blair, for us when it comes to the role of pharmacists in the cannabis world? What are you seeing?
So if we're more involved in the education part, I think if we can lower the stigma between what the history is
Mhm.
and then provide the education, that's going to really empower everybody and make the conversations much easier and have the patients come up. So if you're just advertise, get involved, advertise about it, and learn about it. A lot of these companies that have been involved for some time, especially out of Kentucky. Kentucky was one of the first states to essentially start this program back in 2014. So Ananda is one of those companies. They'll have a lot of resources on their websites, and you're able to learn quite a bit from there.
Wow.
A lot of the other things that I like to do anyway, just put PubMed in your Google search first, and then follow along with anything else, and you're going to have a plethora of articles and things to go through.
Okay. So basically your real push for the pharmacy world is stay educated and stay informed, and then make sure that your patients know that you can be a resource for them already. Regardless if they have questions related to these products, you have to be able to master them to a level that you can be looked at as a resource in your community. So when things like what are happening in Georgia come along, it's a very easy transition that people are already getting the education from you related to it. They've got their entire drug compendia, their entire regimen that they're talking to you about, if that's CBD, cannabis, prescribed medications, legend drugs, OTCs, it's all under your umbrella. So now, really easy transition. Okay, I love that, Blair.
I mean, Epidiolex is a CBD product. It's 10% CBD. It's FDA approved. There's a whole slew of information on there already in the package insert. You take it with food, okay? You take it with food, you're going to have roughly 5 times as much absorption. So you can time it up that way. You know that information as a pharmacist. You got CBD going through CYP2C19, and then you have Delta 9 THC go through CYP2C9. You already know a whole slew of medications that go through that process interaction. So even with that little bit of information, you can guide the patient along a good path.
Awesome. Yeah, I think that's brilliant, Blair. So when it comes to that path and the stuff that you're trying to do, let folks know a little bit more about what you're trying to educate on the RPH Ally channel. I mean, if you have any questions related to CBD, if you're an expert inside of that space, if you're just interested in it, join Blair's channel, start asking good questions, and just get the conversation rolling, I think is the one thing I know Blair's told me before. But other specifics, Blair, on if someone comes in and they really want to learn from you, what are the things that you're focusing on?
So just the basic information of, especially within the neurosciences, and of course I'm going to get in the GI track, but the other thing I'm bringing in here is the finance and the economic scale of what you could bring in. So it's more of, how are you going to expand this side of the business? So I'm not going to bring in, some accountant or anything. I'm working with an economist on this whole product and everything, and looking at it from a very over encompassing preview that'll give you really good information on how to target, say your business in whichever area you've got. So whether if it's rural or, you got a high density spot and you're competing against, 5 other little shops around you that I don't see are going to be really around probably in 18 months.
Interesting. Wow. That's a hot take right there, buddy. Yeah, no, I think that's perfect. Just letting folks know that if you are in any pharmacy setting, that Blair has really broken down the CBD world for you to be able to educate on what do you need to know as a pharmacist to be more successful in helping patients with cannabis as a specific drug, and then all the other nuances that come with this particular agent and the multiple constituents within inside of it, how you leverage those in the clinical space and the business space so that you can become kind of a forerunner in that world. I think most importantly, if I can even speak for Blair here on this, and he can reemphasize it, is cannabis is here. Patients are utilizing it. We have to be informed and be able to utilize it for our patients and populations. And that's a very real thing as of this date in 2023.
Correct. So the better options, for it's patient safety is the major concern. And this is just going to help. If you start now, you can do your own little individual thing and be okay in 18 months to 2 years if you start now. Okay.
Love it. Love it. Well, thank you so much, Blair. Always appreciate you, my friend. Thanks for all the work that you're doing over in Georgia and to educate pharmacists on this kind of growing.
Oh, yeah. And this has been great.
Even expanding space. Everybody, if you want to join the conversation, ask Blair more questions, give more details to the pharmacy community, jump onto the cannabis channel inside of our PH Ally and you can get there through rphally.com. Any other questions for us? Put them in the comments here. Thanks for everybody for tuning in, and we will see you guys next time. Have a good rest of the day.
Thank you, Kevin. Cheers, everybody.